Hello everyone, welcome to Smiley Dental. I am Dr. Prachi Mishra, dental surgeon. We all know that it is very important to brush twice a day, but it's equally important to brush the right way. The right brushing technique is very important. So today we will know about the right brushing technique, the kind of brush, the kind of paste, and what other methods we can use to maintain our oral cavity. So let's start with the kind of brush. The very first step of brushing. There are lots of different kinds of brushes available in the market. We would usually prefer to use a soft bristled brush. You can get a super soft, hard or medium brush. We don't require a medium or a hard brush because that we don't require that much of force for cleaning our teeth. So we need a soft or a super soft brush for cleaning your teeth. Now the brushing techniques. When we brush, we start with the outer surface. We use a circular motion for the outer surface for the anterior as well as our posterior teeth. After the outer surface, we move on to the inner surface. Now the anterior teeth, the inner surface for both your lower and your upper teeth, we use a to and fro motion and up and down motion. For the inner surface of your posterior teeth, a to and fro motion. And for the chewing surface, again, a to and fro motion. This is the most important surface, the chewing surface. So again, a quick recap. We do a circular motion on the outer side, an up and down motion for the inner surface for the anterior teeth, and a to and fro motion for the inner surface of the posterior teeth, and a to and fro motion for the chewing surface. It is a study that has shown that usually people brush for only 45 seconds, whereas proper brushing time should be for at least 2 minutes. We know that our teeth bear a lot of pressure, a lot of stress, especially our molars, that is our posterior teeth. It is known that our teeth itself, they take about 200 pounds of force. So you know how important it is to keep your teeth strong and to brush the right way. Moving on to the next point is the kind of paste. Now there are lots of different pastes available in the market. You just need a normal fluoride paste to brush your teeth. You don't have to follow every marketing gimmick and go for salted or a charcoal or different colored pastes. There are few medicated pastes available, and if at all you require a medicated paste for treating sensitivity or issues related to that, your dentist would advise you. Otherwise, you can go for a normal fluoride paste. After we brush, what is very important is that we floss. Now flossing is a nylon thread which is used to clean the interdental spaces, that is between the teeth, the spaces between the teeth where your brush cannot reach, where the bristles of your brush will not reach. So for that area, we need a floss. Like I had told you earlier, in our earlier episodes where we discussed different facts and myths about teeth and oral cavity. If you don't floss, the 40% of your teeth you're not cleaning. Again, if you do floss, the chances of infection in your mouth decreases to such an extent that your life expectancy can increase up to 7 years. So flossing is a very important part of dental care. Now, how do we floss? We start again from the anterior teeth and we move our floss between each tooth and clean both the surfaces, both the sides. We do it very gently. In the beginning, it will be very time consuming and slightly boring as well, but gradually you will get used to it and it will become a part of your daily habit, daily morning routine of brushing and then flossing. So we do it for every tooth, and flossing is specifically more important during the night before you sleep, after you brush. Now, after floss, we usually advise people to use a mouthwash. It could be a normal mouthwash, a medicated mouthwash, but please use a mouthwash. Choose your mouthwash after the advice of your dentist, because there are certain mouthwashes that are available in the market which have which are quite hard. They have a chemical. They have certain chemicals that are used for severe cases of gingivitis in which people have severe gum diseases. So if you use it in a normal case, it can cause more harm, more side effects than it can be useful. So you use your mouthwash only after the advice of your dentist. Now there's another kind of brush that is available in the market. This is an interdental brush. This is also a use and throw brush like your floss. I forgot to mention earlier that these flosses are just use and throw. You use them once and then you throw them off. You don't use them again. Interdental brushes, these are very soft brushes. You don't have to use any paste on these brushes. You just have to wet them with water, and they're used for people, they're used on people who have spaces between their teeth or have a lot of food lodgement, a lot of food accumulating between their teeth. So those people can use these brushes instead of using toothpicks or pins. So be away from toothpicks. You don't need to use toothpicks. You can use these brushes. They're very comfortable to use, and very easily they just slide inside or between the teeth, and they will clean the area between the teeth. So we have a soft or a super soft brush which will clean not only your teeth but also massage your gums with the right brushing technique. Then we have a floss, a mouthwash, and an interdental brush if at all required. With all these things, I'm sure you can take good care of your oral cavity, oral dental hygiene. And I hope you found this video informative and useful. And if you did, please remember to subscribe to our channel and click on the bell icon. And for any other queries, kindly comment on the comment box. Thank you.